You are listening to Stribling's New York. This is Rob Taub on WORAM Radio 710 on your digital dial. I'm here in the studio with our producer, Tony Simone, and we have on the phone all the way from Houston, Texas, our frequent contributor, Dr. Jeffrey Brown, who is the top doc in Houston and first and foremost, the top doc at Stribling at all times. And I sent you recently, Jeff, welcome. I'm talking over you.
It's a pleasure to be here.
I sent you an email recently about red wine and from an Israeli study supposedly being helpful. And I'm so curious because you talk to somebody and they're like, no, you shouldn't drink. Yes, you should drink. 2 drinks a day is good. Drink moderately. Who's right?
Everybody. It really depends. It's sort of like the crisis of should a person be on testosterone or estrogen. But this study was done at Ben Gurion University, the one that you sent me, and that's located in the Negev desert, if I have my geography correct. And it was interesting. It was a study on diabetics, and just as you say, people say, oh, you shouldn't drink, you should drink. They did a study specifically looking at red wine, and this was done in October of last year, looking at did they have less heart disease. The interesting thing is, in my opinion, it really wasn't the best study because what they did, they gave these people red wine versus white wine. And red wine does have an advantage over white wine because it has some stuff in there called phenols that makes the red wine red. Sort of like in grape juice, okay, because grape juice might help too. But what they did when they did the study is they changed the diet on them. They put these diabetics that were well controlled, which means they had normal or relatively normal or acceptable hemoglobin A1C levels of 7% or below. But they put them on a Mediterranean high-fiber diet. And the question really is, was it the red wine that decreased the heart problems, or was it the Mediterranean diet? And it's hard to say. I remember in college drinking red wine. It was also probably the same type of wine they used in the study. MD 2020, they still
Mad
have that
Dog.
out there. Yeah, Mad Dog, of course. Mogan Dave.
Very excited about
Yes,
Mad Dog.
I thought that all wine came with just a screw top back in those days and in giant jugs.
Well, I won't go. I go to a restaurant and ask, what wine do you have in a box? I don't know why they give me dirty looks, but they do. But, you know, it's the redness of the wine, not the alcohol of the wine, that really makes it fighting heart disease. And it has properties of these phenols, or which does it. And what it does, it increases the good cholesterol, the HDL, and it makes the incidence of heart disease less, especially in diabetics. But the problem is, you're right. If you drink more than 2 glasses of wine a night, even red wine, you're asking for trouble.
More than 2.
Yeah.
I'm in trouble.
Yeah.
A lot of people are in trouble. I thought it was 2 bottles. That's what I've been drinking. All right, I'll cut back.
I use those little airplane bottles. You know those little airplane bottles that you get on the planes?
Yes, of course. I like the scotch very much.
I do too. But no, it was an interesting study. So it really shows you, a little does you good. A lot doesn't do you well. And I think that we should drink a little wine if we could, if it's okay. But more than 2 glasses, you're asking for trouble.
Well, I think like anything else, as you and I have discussed many times, is we also have to look at ourselves as individuals. And I really have noticed the last few years, especially upon turning 60 a few months ago, that my ability to consume any kind of alcohol is just not what it once was. And so a couple glasses of wine makes me more tired than anything else. What's going on there? That's a good one. Why I can't even feel giddy from my wine. It makes me just sleepy. What's happening to my body there?
Well, it's changing its metabolic effect. It's affecting your brain in a way that is different than it did before. And it becomes what we call soporific. It makes you sleepy, and your metabolism just changed to how your brain metabolizes alcohol, and that's really what the difference is.
Is there anything I could do? Can I get an operation? What?
Well, you get a brain transplant. I mean,
Okay, but
right.
that's it.
Yeah, that's about it.
Okay. So I can't even enjoy the effects of alcohol that much anymore. It depends on the night.
Yeah, but you know what? Someday you'll be able to get the good effects of alcohol in a pill. You won't even have to drink.
Oh, I would like to invest in that company. What else?
Won't we all?
So what about regular alcohol? Let's not talk about the grape, but what about the grain?
Grain alcohol isn't as beneficial for vascular disease as wine. You have to be careful depending on the amount of sugar content of the alcohol for the effects. Clearly, the higher the alcohol content, the more likely you are to get drunk right away. But if you're diabetic, the higher the alcohol, the more likely you are to get hypoglycemic or a hangover the next day.
And your blood sugar is going to crash. Well, what about something like a bourbon as compared to a scotch? Bourbon is made with corn.
Corn theoretically has a higher glycemic effect than the grains do. So for example, if you ate an ear of corn versus a loaf of bread, you get a bigger glycemic bang for the corn than you do from the bread.
All right, now I'm going to get really tangential because are you familiar with the book the China Study?
No.
Okay, it was back in the day when Chairman Mao was Chairman Mao, and he decided to do a study on what people are eating in China, and so it had an unlimited budget, and they were finding that a lot of the agrarian peoples there were very, very healthy because all they ate were farm-to-table vegetables. So I thought, they didn't have diabetes, they didn't have heart disease, everything was hunky-dory with them, and I tried going on a strict vegetarian diet, and my blood sugar was through the roof. So a vegetarian diet is primarily all carbs.
Well, it can be, and that can be an issue. There's some. It depends on what vegetables you eat, but yeah, the problem in China, the reason why they did better on their diets is not so much the diets; they were out in the fields working.
That's true. Okay.
The
book didn't mention that.
Happened.
Yeah.
Well, it's funny because now they have a big issue, a big problem in China with diabetes. They have at least 250 million diabetics there. At least.
It's growing in Asia, and why is that? Just because there's just more urbanization and less of an agrarian life?
Well, they have the gene that causes insulin resistance, high cholesterol, and triglyceride. Because that same gene, if you're in an agrarian society and it's working, and your food intake isn't much, it makes you store fuel as fat. You put somebody then in a city situation with all the food you can eat and not the exercise, that same gene that would make you survive now gives you heart disease and diabetes. That's why there's such a high incidence in Native Americans and in Mexican Americans, all those that have Native American genes. It all comes from Asia.
Well, it's something that we don't consider, and you and I have also talked about. You had a great, I don't know if it's an anecdote, but you talked about when you were a kid, you were out playing all the time, and now for young kids, playing involves working their thumbs on a handheld device or playing a video game. So it's not just diet, but it's also lack of exercise and activity and more of a sedentary lifestyle.
Absolutely. In fact, that may be the biggest variable is the lack of exercise. You can get away with a lot of dietary indiscretion if you exercise a lot. You really can. And so the more you exercise, the more cheating you can do on your diet. I'm not to tell you how to cheat, but it's the lack of exercise that's really killing us all.
So if you were king, and maybe the next president can appoint you attorney general, it's surgeon general, even though the surgeon general really never operates on anybody. But what can we do just as a whole, as a country, just as a simple next step?
Require exercise in the schools. Do you know that there's some school districts that have done away with physical education, and they've used computer studies in its place? That's terrible. That's killing us. They need to require physical education in the schools. That's where it starts at a younger age.
Right, most of these kids can't walk around the block, but they could crush a Volkswagen between their thumb and their forefinger. So that's what we have to work on.
Absolutely.
Well, Jeff, thank you so much for joining us again, Dr. Jeffrey Brown, who was an endocrinologist
Pleasure.
practicing in Houston, and we'll have you on again very soon.
Thank you. It's been a pleasure.